Hi everyone, May is Skin Cancer Awareness Month, and as a medical esthetician, this topic is very dear to my heart, so we're going to go into how to prevent skin cancer in this video. Today we're talking about prevention because that's the most easiest way to reduce your risk of skin cancer. As someone who struggles with pigmentation, I'm obsessed with skin protection, not just for aesthetics, but for health. So did you know that 90% of non-melanoma skin cancers and 86% of melanomas are linked to UV exposure? So this is my must-do prevention checklist. So sunscreen, every day, every single day. Zinc oxide based sunscreens because they're gentle, effective, and great for my pigmentation. So when I can splurge, I love the Colorescience. Their tinted formulas are amazing for blending in, and you can still see my freckles and sunspots, but it allows for a HEV or blue light protection as well, which also causes pigmentation in the skin. And on tighter budget days, then I opt for the Banana Boat Simply Protect, and it's a zinc oxide option that's affordable and non-comedogenic, and it actually helps to prevent the UV rays from fully absorbing into the skin. For the face, basically 2 fingers, and unfortunately with zinc oxide based sunscreens, I do have to massage it in a little bit, so I take it as an extra opportunity for me to give myself a little bit of love and drain some lymphatic fluids. For the body, I actually use this on my face as well. You need a shot glass, enough value worth to apply all over the body. So don't forget the neck, as well as the ears, and on top of the hands, because those areas have shown to have higher levels of or higher possibilities of skin cancer exposure because we don't pay attention to them that much. So it's not just about your face, it's about those often forgotten areas where skin cancer loves to hide. So on the ears, they account for 6 to 10% of all skin cancers, and the rim of the ear is the most common spot for squamous cell carcinoma, or SCC, due to direct sun exposure. So even if we're wearing a hat, make sure you're covering the tips of your ears. The neck and scalp are also high risk areas, so wearing a cap helps. Melanoma is 2 times more likely to occur on the scalp and on the neck in men compared to women, likely because of the shorter hair cuts and less coverage. Hands are also exposed to UV rays daily, especially like when you're driving, and studies have shown up to 90% of aging and damage on hands is from sun exposure. They're also a common site for basal cell and squamous cell carcinomas. So since these sunscreens are a little bit sticky for the scalp area, I opt to wear a hat when I'm exposed to the sun, or there are some sunscreen sprays that you can buy, and some of them don't have that many chemicals or things that could cause my skin to be more allergic, I guess you can say. So remember to wear physical barriers, wide-brimmed hat, UV blocking gloves are great for driving, and yes, UVA does penetrate through car windows. Also do self-examinations regularly and ask your partner or sister or brother to check your ears, neck, and scalp for any patches of roughness or sores. And so this is where I usually find some tricky spots where I would mention to my clients, say, hey, you should go get that checked out by a dermatologist. So skin cancer is preventable, so let's stop treating sunscreen like it's just for beach days. It's a daily health essential, just like brushing your teeth, even if it's a gloomy, cloudy days like it is in Vancouver sometimes, most of the time. So are there areas that you forget to protect? Tell me in the comments. And stay tuned for the next part of the series. And for my recommended sunscreens, go to my link tree above, and there will be a list of basically non-comedogenic and non-irritating formulas, or less irritating formulas, that almost everybody can use. But if you've got like certain skin problems like rosacea or eczema, psoriasis, or other problems, then your skincare ingredients are even more limited, and feel free to reach out and ask me which recommendations I have for those. They are also listed on my link tree as well.